Hi everyone, welcome to my session, a simple overview of the differences between an assistant practitioner, nursing associate and registered nurse. And this session is for healthcare assistants, nursing assistants and health and social care support workers who might wish to become an assistant practitioner or nursing associate or registered nurse, and staff supporting them. So it might be a clinical educator or a line manager who wants a bit more insight into the academic levels and differences between these roles. Also, newly registered nurses and experienced staff might be unsure about the differences, and it can help delegation across teams to have a bit of insight into the roles. So if I start with the different academic levels and what's easier is to talk about example roles from support worker to registered nurse. And if I start with healthcare support worker, nursing assistant, clinical support workers, these roles are usually set at a band 2 on the Agenda for Change pay scale. And although there may be differences across private institutions versus NHS, and there may be senior healthcare support workers at band 3, the majority would be at band 2. And the academic level aligned to these roles would be care certificate level. And health and social care courses, maybe level 2, 3 or 4 would be appropriate for this for support workers, or apprenticeships at level 2, 3 or 4. And if you're a registered nurse, newly registered nurse, go and talk to your support workers and find out, have they got the care certificate? Have they done health and social care courses, and what competencies have they done, and what sign off on proficiencies have they? Because that's really helpful when you're looking at delegating care when you're registered, and you can do that in your induction or during a supernumerary period when you first start, because what you can find is different health and social care support workers have got different courses and different competencies that they've completed. Looking at the next role, assistant practitioner. Assistant practitioners are usually band 4s, and to become an assistant practitioner you would do a level 5 foundation degree, and in Scotland assistant practitioners do a level 8 Scottish credit and qualification. The framework's different in Scotland, but it's the equivalent level of a level 5 foundation degree. And the other equivalent is a higher, I've checked this morning, is intermediate level higher education, or a national higher diploma would be a similar level. And you'll see that on university websites. Assistant practitioners are a bridge between support workers and a healthcare professional, and they are not just for nursing. You have nursing assistant practitioners, but you can have physio assistant practitioners, occupational therapy or dietitian assistant practitioners. And you'll note that the role is not registered with the Nursing and Midwifery Council either. When you compare that to a nursing associate, the nursing associate is for a nursing career pathway. You'll see the foundation degree level is the same, but they do a nursing associate foundation degree specific for that role. And with a foundation level 5 foundation degree or equivalent, you can top up to become a registered nurse, and it usually takes 20 to 24 months. In comparison to an assistant practitioner, so the difference is nursing associate is for the nursing careers, as opposed to assistant practitioner, which can link to different healthcare professionals. The assistant practitioner is not registered with NMC. The nursing associate is registered with the Nursing and Midwifery Council, but only in England. The nursing associate is only in England. I have seen assistant practitioner roles in Scotland, but nursing associates I haven't. And nursing associates do a different course to an assistant practitioner. So for example, a nursing associate course will do nursing associates will do procedural competencies for administering medication safely. So a nursing associate when they're registered, will be expected to administer medications within the remit of their role and the competencies that they've had signed off, whereas assistant practitioners do not do medications during their course. A really helpful way to look at the differences between roles and compare is to look at the actual standards linked to the roles, where it talks about different tasks that an assistant practitioner or nursing associate can undertake, and that's really helpful for newly registered nurses to look at when they're delegating tasks. And also if you're looking at applying or wanting to develop into one of these roles, to see the difference between the roles. So I went on recently for the Skills to Health website for core standards for assistant practitioners, and it's really notable that education and training of assistant practitioners is work-based and employer-led. So if you're advising somebody that wants to become an assistant practitioner, or you're looking into it yourself and you're a support worker, it's helpful to talk to whoever runs the assistant practitioner program. And also, if there's an apprenticeship lead, they would be able to talk through how the role is utilised with that employer. On the Skills for Health website, an assistant practitioner should be competent to store and retrieve information, provide basic life support, some other examples, contribute to care planning and review, communicate and complete records, prepare, monitor, manage the environment for clinical and therapeutic activities. And it's talking to the employer about how they're defining those clinical and therapeutic activities that would enable you to have insight into the role. In relation to nursing associate, there's 6 platforms and standards of proficiency for registered nursing associates, and there's 7 platforms linked to standards of proficiency for registered nurses. Nursing associates, some examples, might promote health, prevent illness, provide and monitoring care, undertake wound care, undertake risk assessments, escalate concerns. And it's really helpful to go and look at those standards for nursing associates yourself, because you'll have a lot more detail in the standards. In contrast, the key difference really is a registered nurse on the 7 platforms is leading and managing care and coordinating care, whereas the nursing associate is monitoring the care and contributing to that integrated care. So the registered nurses is a leadership role. And it's very helpful to look at those websites when you are applying for courses, to be able to answer. So if you're asked, well, what do you know about a nursing associate role, or what do you know about what a registered nurse does? And if you can say that you've looked on the Nursing and Midwifery Council website and you know that there's 6 platforms, say for example for a nursing associate, and these are some of the tasks that they might undertake, that will really impress the interviewers. So that's really important to look at. The academic level of a registered nurse in comparison is a level 6 Bachelor of Science pre-registration degree in nursing. Some people will do a master's pre-registration degree if they've already got a level 6 degree, but not all universities offer the level 7. You come out with the same registration as a registered nurse, whether you do level 6 or level 7. A level 7 master's may be for somebody as well that wants to pursue a clinical academic career later, for example. Oops. So summary of key differences. The NMC registration I've gone through, the difference of an assistant practitioner is not registered with the Nursing and Midwifery Council, whereas the nursing associate is registered as a nursing associate in England. The registered nurse is a level 6, so looking at different academic credits versus a foundation degree. Standards of proficiency are different, and the agenda for change nursing band, which is what you will end up applying for once you finish your course, are different across the courses and roles. How long the courses take. A level 5 foundation degree to become an assistant practitioner is usually 2 years as an apprenticeship, or you can self-fund. Most people apply for apprenticeships. A level 5 foundation degree to become a nursing associate, again, is usually 2 years as an apprenticeship, or you can self-fund. And there may be slight differences between individual universities, so it might be 18 months, for example, but usually they're about 2 years to complete these foundation degree apprenticeships. Traditional level 6 bachelor degree is usually 3 years full-time, and part-time would usually be 4 to 5 years. Dual registered nursing degree is usually 4 years full-time because you're doing the 2 fields, but again you can extend for another year or 2 onwards after that. And a level 6 registered nursing degree apprenticeship is usually 4 years, and again it can be flexible over 5 to 6 years. I should say a level 6 registered nursing degree apprenticeship, there is not as many of them available. You usually have to be working for an employer for a period of time to be able to undertake a level 6 and be supported with a level 6 registered nursing degree apprenticeship too currently. What qualifications? So if you're going to do a traditional level 6 bachelor pre-registration nursing degree, you apply through UCAS. Usually you self-fund. It's rare for employers to pay for a full-time because you'd be going off for 3 years and wouldn't be coming back for 3 years. Very rare for employers to self-fund, but I have known some private employers to tie people in after, but it is rare. You usually need 2 to 3 A levels to do the traditional full-time route or part-time route, or the equivalent would be health and social care level 3 courses, for example. Different UK universities have different entry criteria, and the A levels, the grades might be slightly different, so some universities request higher grades to others as well. Apprenticeship route, you'll need a minimum of GCSE Maths and English grade C usually, or equivalent. You can check on websites and ask apprenticeship leads if there's any difference to that, but usually you need those 2 GCSEs. And the equivalent would be Maths and English Functional Skills level 2 to apply, for example, for a nursing associate apprenticeship. Some employers will, if you're a nursing assistant or support worker, they would pay for you to do your Maths and English level 2. So do check with education leads if they will fund your Maths and English functional skills. If not, you'd have to self-fund. Once you've got those qualifications, you'd be able to be shortlisted and be able to apply for a nursing associate apprenticeship. If you're interested, I've got a bit more detail on my other video, Becoming a Nurse and Different Routes into Nursing. Also, check out my video, Pre-Registration, Nursing Application and Interview Tips, and Application and Interview Tips for Trainee Nursing Associate Apprenticeships. So hopefully that will give you lots of advice. If you've got any questions at all, put them in the YouTube questions. You can contact me on my website or DM me on Twitter or Instagram, and let me know how you get on, and if you do pursue a career, how you get on at interview. So if you do go for any of those roles, good luck in the future. Keep going, you can do it, and I wish you every success in the future.